You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with mini dental implants. With us, we have an expert on the topic. He says, if you have been told you have to wear a traditional denture, he said that he could take care of that. He'd give you a fixed set of teeth that don't come in and out. And for those of you that are wearing dentures, he says no more traditional dentures. With us, we have an expert on the topic, hot topic, Dr. Leibowitz. Dr. Leibowitz, welcome to the program.
Thank you.
Now, for people that, before we get into today's topic, I have a lot of questions for you, but for people that don't know your practice, who's your typical patient and what are the different services you offer?
Well, really, the typical patient that comes into the office comes in for the normal dentistry that we do every day, whether it be a cleaning, a checkup, whitening, root canal, fillings. And I found over the last few years that I enjoy doing things that are a little different. Because through the years, a lot of my patients have lost teeth, and some of them for no reason of their own. You get older, there's bone loss, you bite into something hard, the teeth become brittle, they crack, they break, you get into an accident, a tooth gets knocked out. And I found over the last few years that I became very involved in replacement and restoring mouths that have been, well, challenged, basically.
Okay, and at the top of the show, we said, look, no more traditional dentures. You don't think anybody should be wearing just a denture that's not attached to something. Elaborate on that.
The traditional dentures are wonderful appliances that replace missing teeth, and that's about all they do. They don't give you the enjoyment that you'd like to have when you eat food, when you talk, when you have an argument with your friend or your wife. Okay. A traditional denture, it basically holds the place and it looks wonderful. They're made beautifully, but they don't stay in the mouth. They constantly move around. Whenever you have a traditional denture, you're always, always, always going to have something moving around. The upper part, the lower part, it's just not comfortable.
Okay, are there a lot of people wearing dentures or headed for dentures where you are?
Well, let's put it this way. I'm from New York City. There's a lot of folks there. California has a lot of folks, but in New York City, within a 5-mile radius, I would say that either headed to dentures or basically indentures to some degree, or missing teeth, you'd have millions of people probably in 5 to 10 miles. I mean, you could fill up Madison Square Garden and Yankee Stadium 20, 30 times with the amount of people that are missing teeth or indentures.
So if there's so many people that are wearing a denture or headed to dentures, as you say, why aren't they all coming in to get, something locked in?
Fine.
What's your take? Why aren't they all doing it?
There are quite a few reasons why people aren't coming into the office to do it. I think that you've got a group of patients that have had dentures placed years ago. They're plain old out of the system at this point. They've been told to come in, let us look at your denture, make sure they're fitting well, make sure you're comfortable. And they're just not in that system, and they don't come in, and they basically spent years getting to that place. They tried caps, they tried periodontal therapy, they tried homeopathic remedies, nothing worked. They're in dentures now. They've given up.
So they don't want to go to the dentist?
They gave up, no more.
Do you hear that, by the way, still? Because nobody likes going to the dentist, right? I mean, do they ever say, doctor, no offense, but
when I'm at a party, Randy, when I'm at a party, there are people that aren't my patients that come over to me, and they actually, at a party, take out their dentures and hand it to me.
Really?
And ask me questions about them. And I said, sir, let's go in the back at least. And I asked them, why don't they go to the dentist? And they say, well, basically, I don't want to go anymore. You're a nice guy. I'll talk to you here. So also, you've got that patient who's, well, they self-diagnose. What can I do? I'm too old. I can't go through this. I've got health issues.
How old can you be?
Oh, I actually did an implant case on an 84-year-old. I mean, this is an interesting type of procedure I do. I do something called a mini implant. Okay. Now the other implant is a conventional implant. It's a root form. It's quite a bit thicker than the mini implant. And there's some surgery involved with it. Whereas the mini implant, there's basically very little, if any, bleeding when you place it.
Isn't it true, though, if you've been wearing a denture for 20, 30 years, not enough bone to get this procedure done?
You know, it's interesting. The longer you wear a denture, the less there is of bone. And with the other conventional implant, you can still have that implant placed, but you need things called bone augmentation. We have to thicken the bone. And sometimes what we'll do is we'll actually take a piece of bone out of your hip, the iliac crest, and we'll transplant it there. And that in itself, well, it's a procedure, and it takes anywhere from 6 months to a year to heal. Whereas with the mini implant, I can use that thin piece of bone, place the implant, and send you home that day with a denture that snaps right into place.
And they could eat what?
You can eat anything. I mean, we're talking no more denture cream. Now, denture cream, there's another nightmare for patients.
They don't like it. They tell you this?
Well, it's like Cholula sauce. It's like ketchup. I mean, they're so used to it in all their food because they glop it in, and it's awful. They can't stand it. I mean, it goes into your stomach. It ruins your digestive system. I mean, to be without denture cream, oh, what a blessing. What a blessing.
Yeah, and I was laughing. I didn't mean to laugh at the people in that situation. I was laughing because I appreciate your enthusiasm over this. But you said, we talked on the phone, that you're changing people's lives. You believe that?
I got to tell you, I started in dentistry when I was 23. I'm 63 now. I'm working with this procedure 4 years and more. And I had a patient, Jack. Jack came into the office because he needed crowns on the bottom, and he needed all his teeth taken out on the top. And Jack was explaining what had to be done. Jack came in, put his teeth in a stable position on the bottom, because I saved a lot of his teeth on the bottom. His upper arch, it was hopeless. We put him in a denture. He just kept looking at me and saying, I hate this denture. It's covering my palate. I lost my taste for food. I can't stand it. My bottom feels great. Can't you do something? And I said, Jack, absolutely. We could change your denture. Instead of using paste and covering the palate, I could put these mini implants in, 4 to 6 on the top. We could make a new denture. It'll snap in. And Jack, your life's going to change. And here's another thing, Jack. After we make your denture, if you find you don't want to have something removable, I could use those same implants. I could put more implants in, and I could make you permanent caps. And Jack said, what are the costs? We went over the fees. He said, well, you know what? Let's start with the denture, see how it goes. And we did.
So a snap in, snap out.
Wonderful. Wonderful. He was so happy. Well, Jack had this wonderful denture, but when you have a denture, it has, even though we don't have a palate anymore, it does have an area around the front of the gum tissue that fills it in. And you can always, well, I can, and I think other people can, see that there's a denture there.
All right.
And every morning, you need to take it out. And even though it's wonderful, and I promise you, most people love it, there are folks that they just don't like taking those teeth out. They want to have something that'll be permanent, not come out. And with Jack's case, he had bottom crowns that were permanent and never came out. He was spoiled and half spoiled on top. Okay. And Jack could afford it. So Jack said, let's change it. I want to put those caps in that you said we could do. And Jack came in, and that day we did the procedure, Jack walked out with crowns that were permanent. Now, granted, these were the temporaries. And Jack walks in the office, and Jack has the other mini implants put in conjunction with the other. Now, I had 6 implants in Jack's mouth to start with, and I need another 4 more. I ended up putting 13 implants. And within an hour, Jack walked out with teeth that were permanent. He actually had
full teeth, arch of teeth,
full arch
and they don't come in and out.
Teeth. The only one that would take those out was me, and I'd have to struggle to get those out. But yeah, those were the teeth. Jack told me I changed his life. I made him feel whole again. He was no longer embarrassed. Now this is a full book. This story, a novel. He started with started with teeth. He barely came out of his house. The start to finish it was like a chameleon. It was like a butterfly that came out from the caterpillar. You should see the guy. He walks with such confidence that he never had before.
What about pain, though?
The pain issue.
Seems painful.
It's so minor. I've done many of these cases, and very few of the patients complain about anything more than basically the soreness of the Novocaine shots that I give you, because I do have to get you numb. When I give them to you, they don't feel bad at all. It feels great.
So during the procedure, you don't feel anything?
Oh, no, nothing.
Okay.
Nothing.
And the gums are a little sore after?
Basically only because you're sore from the shot you get. You're always sore. Get a shot in the arm and it's sore. So you feel the soreness of that. I mean, there's such little pain. I give them minor analgesics. Very few times do I give them anything with narcotics in them. They just don't feel pain.
So Advil, or what do you give them?
Advil liquid gel I like because it's easier on the stomach, but there's other pills they can use. They might like to take Tylenol. I personally like the Advil better. I seem to have it working better with the patients.
Now, let's talk a little bit about your background and training, because you used to do only traditional, regular dental implants. And for people just tuning in, this is not to be confused with traditional implants. These are mini implants. So, and there's a lot of critics that are skeptical. They say, they've told me, Randy, I don't know. We use them as provisionals. We use them as temporaries. You say that they work. You could give people a fixed set of teeth. So how'd you get involved?
I got involved because basically I had a patient she went through the whole gamut, another novel. We replaced a lot of her teeth through the years. She was basically a hopeless case because she had a periodontal condition that she knew she'd be losing her teeth. She had gotten to the point where she had to lose all her teeth, and it took 30 years and lots of dental work, and it was the novel. And this poor woman, I told her finally, I said, Randy, you're gonna have to lose your teeth. You're gonna be in a denture for a while, 6 months to a year, and you're gonna have permanent teeth because we're gonna put those, and it was conventional implants in place, and you're gonna walk out with permanent teeth. And Randy trusted me.
Okay.
And I brought her to the surgeon, and the surgeon took out her teeth. And the surgeon had to put extra bone, that bone augmentation in her mouth. And we waited 8, 9 months. And she made the appointment. We selected the implants. I made temporary crowns for her. It was great. She came in for the surgery, and it was being done in my office. And I'll never forget the surgeon coming out and looking at me and said, I can't place the implants. Her bone is like eggshell. These conventional root-shaped implants, they just won't hold. Okay. And I walked in the room and there was Randy crying, and she looked at me and she said, Dr. Rodney, you promised me. And I looked at her and I said, Randy, I'll find a way. And I'll never forget walking into my back office, and I had tears in my eyes. And I came out and I said, Randy, we'll find a way. And I really, for the first time in a long time, I've taken courses through the years, all the time in dentistry. Continuing ed, I've taken them, I've given them, I enjoy them. But I never really understood the mini implant. So it was this gentleman, a dentist, an innovator, giving a lecture. And it was only a 2-hour lecture on the mini implant. And I took this course because the mini implant might be Randy's answer.
Okay.
I went to the course, wasn't large, maybe 12 people in it. And I'm sitting there in the front row. I always sit in the front row when I want to listen, back row when I want to leave.
Okay.
And I'm sitting in the front row listening to this. My God, this can work. I walked over him on the break. I said, when is a hands-on class? This innovator looked at me and said, well, I'll have one next week. And I said, you know the stuff you schlepped on the airplane? I want to buy it all right now. I'm coming to the class next week. I was so excited. I got in my car. I called Randy up on Friday. My office was closed on Saturday. I said, Randy, meet me at my office tomorrow. We're starting tomorrow. Of course, she showed up. The end of the story is I went to the class, did a lot of work with it. Month and a half later, Randy had permanent caps with mini implants to this day.
So when you say caps, you're talking about teeth?
Teeth.
Upper and lower
permanent teeth.
That don't come in and out.
Don't come in and out.
Supported by mini dental implants.
Only supported by minis. Tried to put the conventionals. They wouldn't work. Only the minis would work.
So you were sold at that point?
It was over. I mean, this is a life changer. And it is a life changer. I've been doing many, many cases.
It's less expensive too, right?
It's so
like
much
about 60% less?
Sometimes 70% less without the bone augmentation. It's so much less.
Would you do it on your own family member?
In a heartbeat. In a heartbeat. In a heartbeat. I'd do it on myself if I needed one.
So no more traditional dentures?
There is no such thing as the traditional denture if you can afford it. And if you can't afford it, I'm going to try and help you because it's a life changer. And I've had patients that have actually, older patients that are in fixed incomes. I work with this company, And the mini implants from this company are not only wonderful, they're affordable. They're very affordable to the patients I worked on.
Okay.
My office, where's my office? I grew up less than 7 blocks away from where I put my office in Brooklyn, New York. The area I grew up in, it's regular folks live there. My dad was a truck driver. My neighbor was a plumber, an electrician, policeman, fireman. These are real folks. These are you, these are me. These are people who deserve to have dentistry just like people who can afford to do anything they want.
With these implants, you know, the fixed set of teeth that you put in, with the mini implant, could you eat like a steak or vegetables or whatever?
You know, it's interesting. I actually had one patient, I placed the mini implants in on the top of her mouth. She had a denture, and I put the caps in her mouth that day, and I get a phone call. I'd say about 45 minutes later, her daughter picked her up. She was from New Jersey. She came in to have this done, and she shows me a picture. It looks like she's eating a sandwich. I looked at her. I said to her on the phone, I said, "Where are you?" She goes, "I'm at the diner. I'm with my daughter, and I'm eating a corned beef sandwich right now." We're talking 45 minutes afterwards. Now, I tell my patients you can eat immediately. She took it literally, and I'm glad she did, because she ate immediately.
Doesn't that make you nervous, though? I mean, you just put them in, and they could eat?
Not at all. They're so secure, not even a little bit. These things are in for the long haul. They don't get loose. They're in.
You compared it to building a bridge.
That's just what it's like. It's like building a bridge. If you build the proper supports, even though they said when they built the Brooklyn Bridge, it'll never hold. And do you know when they built the Brooklyn Bridge, they took an elephant across the bridge to make sure it wouldn't fall, because an elephant knows when something's going to break down? Well, I'm not putting an elephant in your mouth, but that mini dental implant, that's going to support your teeth perfectly. They're not coming out.
And so they could eat. I mean, they could eat vegetables. They could eat whatever they want.
Whatever they want. Steak, sandwiches, vegetables, candy. It doesn't matter. They're your teeth. They're permanent.
So regular dentures, they can't really eat those things? Because I know a few denture wearers, right? And they never seem to complain. They seem to be fine. Are you saying there's no such thing as a happy denture wearer?
You know, if you complain, nobody wants to listen to you. People, they gravitate to people that are happy. And denture wearers learn that very quickly. Why complain? Nobody really cares. But they don't enjoy their food. I talk to these denture wearers many times.
What do they say? What's their biggest complaint?
I can't taste my food anymore. The denture cream, all over the place. It tastes terrible. The movement of my denture when I'm eating gets in the way of my food. When I'm talking and I get into a heated argument, I've even spit out my dentures. I hate it. Who are they going to complain to? They can only complain to a dentist. Right. Nobody else cares. Nobody can understand. Let me tell you about the life of a denture wearer. It's not a wonderful place to be. It's basically a living nightmare. They can't eat food anymore the way they used to. They can't taste food the way they used to. They have plastic in their mouth that covers taste buds. The top of your palate has taste buds. Those taste buds are covered. You can't really savor the food with your tongue, with all those taste buds in your tongue, because that tongue is helping to push the lower and upper denture back into place. It's not a wonderful place, the life of a denture wearer. You've got talking. You talk nice and slow. But when you get into a heated argument, you're screaming and yelling, and all of a sudden that denture pops out of your mouth. You just lose your confidence with the denture. You try your best. You live with the denture. You don't really live. You live with it. It's basically controlling a lot of the things we all take for granted today.
Do you think that, because you said, look, tens of thousands, you could fill Yankee Stadium or some stadium.
Madison Square Garden.
Yeah, we're
Yankee
taping here in
Stadium.
California.
Absolutely.
So I'm not sure where you. Okay, so Madison Square Garden, you could fill it up. So these denture wearers, they just don't know their option. They think they're too old. They think they don't have enough bone. Let's say there was like a try-in period. Okay, they say, hey, my denture's fine. But they come in, you give them like 10 or 12 of these mini implants, give them a set of teeth that don't come in and out. If there was like a weekend try-in, do you think that anybody could go back once they felt what it was like to have a set of teeth again?
It would be impossible to go back. It would be like taking a person who couldn't see and giving them back their eyes. Not that I want to diminish losing your eyesight, because it's nothing like losing your teeth. but it would make the world of difference to you. You're back.
Do they
You
say
can
this to
enjoy.
you? When it's all
Yes.
done, what do they say?
I have patients actually call. I had one patient, he would call me at least once or twice a week and go, Dr. Rodney, I can't tell you how I'm enjoying my steak, and it's because of you. He would call me in the middle of the evening when I was having dinner to thank and bless me. And then I have another patient. I mean, she comes into the office after I did this and she goes, my grandchildren, they're in love with me. They said I don't have ugly teeth anymore. Grandma, you look great. You look so much younger. What'd you do? Did you have a facelift? I mean, for a patient to come in and say her grandchildren, being a grandfather myself, there's nothing better. To have your grandchildren scared of you, oh my gosh.
So they can look real. Because I feel like I could spot a denture walking down the street. I mean, it's a cosmetic look.
It's so true. Spotting a denture across the street is kind of like spotting a toupee across the street. You think you look great, but everybody else knows it's a toupee.
So the answer is go to your office.
Yes.
And you say, in two visits, you meet them once, they come back, and you give them their fixed set of teeth that don't come in and out. Is that oversimplifying it, by the way?
It's really not. The patient comes into my office for a consultation, and if at that time they choose to do what they want, we start with impressions, we start with x-rays, we order the implants, I order the caps, we wait till I get everything in, we set up the next appointment for the patient. At the next appointment, the patient comes in, we do the procedure, and between anywhere from depending on the particular case, because some are a little more involved than others, between 30 minutes and 2 hours, they walk out with a full set of teeth. And whether it's 30 minutes or 2 hours, there's not an hour and a half more pain. It's the same discomfort, because there's really very little discomfort if extractions don't have to be done.
And they can walk out that same day.
In my practice, just about every day I do at least one case.
Because you guys do everything. And for people just tuning in, and we're talking about mini dental implants, giving people a fixed set of teeth that don't come in and out. You also do a snap in, snap out. But your practice, even though it's not a recognized specialty, you focus on these dental implants.
Yes, I do.
Replace. Now, but what about people that their mouth is a mess? They have bad gums, right? Could they still do this?
You know, that's something that...
And they've been told their teeth have to go.
They've been told their teeth, they have to go. Those are the people that fall through the cracks. They know they have to lose their teeth. They know they have to be in dentures. They walk around with these loose teeth. Now, loose teeth, that's a detriment to your health. When you have loose teeth, bacteria can really get in there and really poison your body and make you sick. And they're afraid. And I see these patients because they're recommended by other patients. It's word of mouth in my neighborhood. It's a very close-knit community. We're all close.
But isn't it true? I mean, if the gums are bad, the implants will still stay in there?
That's something that I tell my patients. It's kind of like when you lose your hair. Your head's healthy, but your hair falls out. You could still have hair transplants placed, and they stay. You could still have bone loss, gum disease through the years, but your bone underneath is still strong, and it can still have implants, whether they be the conventionals or the minis. They could still be placed, and they stay. There's no real correlation between the bone disease and the staying of either kind of an implant. I choose now to do basically the mini implants, although I will restore the others.
So is it true that when you take out these teeth, that the gums get healthier? That means when they have infected teeth and you have to do extractions, gums get healthier?
The gums get healthier, the bone gets healthier. The issue with the teeth being there is the body is treating those teeth as if they're foreign objects, like they're a splinter in your hand. And they build up all sorts of things to get rid of it.
Interesting, like they're pushing them out.
They're pushing them out. This cyst develops. And people hear the word cyst, they get all nervous. A cyst is nothing more than a pimple. A pimple, when you're an adolescent growing up, what's that pimple doing? It's creating white blood cells, that's where the pimple starts, that are pushing out dirt that's underneath your skin. The same thing goes with a tooth that's starting to get loose. Your body's pushing it out. Your body doesn't want that tooth anymore. It pushes it out. What I do is I remove those teeth. And in many cases, the day I remove the teeth, after I've cleaned out all the infected cystic tissue and all the infected bone, that same day I could put an implant right into that socket and if not, into the socket where I took the tooth, right next to it, and put a tooth right in that day.
You know, look, we were talking on the telephone, and you said, Randy, I wish I could do this for free. I would do it for free.
I really would.
Because you take somebody, I guess, with no teeth, you give them a fixed set of teeth, and I guess it's pretty life-changing. I take it for granted, I guess I have my teeth.
It is so life-changing.
Did they ever say, doctor, I should have done this years ago?
All of them do. I didn't know this was out here. Why didn't I do this years ago? All of them want this.
Now, people need to know. I mean, I'm not endorsing you. I'm just asking you the questions. But you say there's like a 5 or 10 year study where they followed patients, several thousand patients with these mini implants.
Several thousand implants have been followed over the years.
And they stay.
And they stay.
And let's say somebody's watching this, right? They're either wearing a denture, maybe they were told they don't have enough bone, or they're in their 80s, or somebody that their teeth need to come out, and they know they don't want a denture. What do you say to them? And maybe they're still skeptical about what you're saying.
I tell them, come in for a consultation. Come in, let me show you what you could have. And if you're really skeptical, let me give you the phone numbers of some of the patients that I've worked on. You talk to those people. They're just like you. They're no different. They gave up. Don't give up. Never give up. Never surrender. You deserve the best. The only person you ever answer to is to the mirror. Make sure the mirror is always happy.
Are the patients ever skeptical? Like they hear about you? Do they ever say, hey, can you really give me a fixed set of teeth?
Once we speak, I look at that patient and they're comfortable. I tell that patient, I'm here for you. This isn't just one case we're doing. I'm your husband. We're married. I'm married 42 years. I'm a good husband.
Okay. That's right. Now, your wife came with you on this trip. I wish you could have brought her to the studio. So, in one day, you walk in without teeth. You can walk out with teeth.
Absolutely.
That don't come in and out.
That's correct. It's wonderful.
Okay, good. I want to thank you for coming on the show. Very interesting. Very good.
You've
been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.